Preparing for IV therapy. Our objectives. At the end of this course, the learner will identify lifespan considerations involving IV therapy, identify anatomy and physiology of the arteries, veins, capillaries, and layers of the skin, demonstrate selecting a vein, describe complications and considerations for therapy, identify IV solutions, demonstrate dilation of the vein, demonstrate proper tourniquet use, and demonstrate proper catheter cannulation. Some lifespan considerations of the older adult. These adults have changes in the appearance of the skin that are related to aging. They include drying of the skin, wrinkling, and loosening of the tissues. There is thinning of the dermal layer, the outside portion, which appears earlier in women than it does in men, and there are some hormonal influences that vary there. The skin becomes rigid and inflexible. In the elderly, blood vessels are less abundant and less well organized in the dermal layer, making absorption of subcutaneous administered medications and fluids difficult. The intima, or inner area of the vein, increases in thickness, and it's less elastic in its muscular walls. Varicosities are not for IV therapy. Just to briefly familiarize yourself with the blood components of the serum and the plasma, once a blood sample is taken and it is spun down, the red blood cells land to the bottom of the tube. You also have a buffy white coating which looks like fat tissues above that area. The liquid above that is called the plasma, and it is the unclotted blood. Components of the blood include red blood cells. These red blood cells are important because they're filled with hemoglobin. The shape of them is like a donut with a concave or sunk-in center. This hemoglobin is very important because it transports oxygens to the cells. Males have about 5 million, females have about 4.5. They're also called erythrocytes. The white blood cells in the cell are also called leukocytes, or important for immune responses to infections and invading pathogens. The white blood cells are made up of many different cells. Some of these are called neutrophils. The phagocytes fight bacteria and fungal infections. The eosinophils is what give us our allergic responses when it's in the springtime or the fall or we have seasonal allergies. It also acts against parasitic worms as well. The monocytes are also phagocytes. They ingest dead cells. That's their job, is to go in and clean up. The lymphocytes secrete antibodies. Our platelets initiate the blood clotting cascade, and it assists us with our blood clotting abilities. This is a diagram of the arteries and veins. You'll notice the many different layers. We have the outer layer, which is a serous layer. Also connected to that is some fibrous tissues. And then you get your smooth muscle layer. Then connected to that is also another elastic tissue. And then you get to the innermost section that carries all the blood and fluids around the body. That's called the intima section. So you'll notice when you have to put an IV catheter in a vein, you have to introduce it into all these 3 different layers. The initial layer, you'll feel a puncture. The final, once you enter the vein, you'll feel a pop, and you're popping through all those elastic layers. The arteries are important because they carry blood away from the heart. They have pulses when you feel them. These different layers, such as the tunica intima, supports the connective tissue. The middle portion, the media, again, smooth muscular tissue with all the elastic fibers. And then the externa, or the outside, has surrounded by all that connective tissue. So when you introduce a catheter, you have to go through all those different areas. Small capillaries feed into veins that carry deoxygenated blood back to the heart. Veins have the same layers as arteries, but there is no pulse. You'll notice they also have a valve. This is to prevent backflow of blood. The walls are also thinner, as you'll notice. They also have a larger lumen, therefore they are appropriate for introducing an IV catheter. Larger veins are found between the panels of muscles in the body and in the limbs. Contraction of these muscles help provide the pressure that pushes the blood along in the body. Peripheral veins are composed of three classifications. You have superficial ones, which are ones you can see right on top. You have deeper ones, which may be ones that you can feel. And then you also have the whole venous system that is much deeper and connects them all. The superficial veins are veins used for venipuncture, IV therapy. They empty into the deep veins in the body. The distal veins of the arms and hands should be utilized first for any kind of venipuncture to start an IV. The veins are located in the skeletal muscles, as you saw by the previous diagram. They're supported and stabilized by the skeletal muscle in each of the limbs. They're easier to penetrate. They're closer to the skin surface. They have thinner walls than arteries and no pulse. They also contain less muscle and elastic tissue. They can easily be distended with a tourniquet and hold larger volumes of blood under a lower pressure. This is a diagram of IV therapy being initiated with a winged needle device. The problem with this type of therapy is you are leaving a sharpened needle within the vein of the patient versus an IV catheter where you're leaving a plastic catheter within the vein of the patient. So you have to consider what type of patient you would use this on. And obviously it would be short-term, very quick therapy. Nothing you would want to leave in for any length of time, because as they move that arm, that sharpened needle will be scraping the walls of those veins. The veins in the hand. Make sure you evaluate the veins of the hand carefully. You want to make sure that you hold the hand and use the C-hole with your thumb and pull the tissue down towards you to make the skin tight. You don't want to use any veins that are crosswise. Any of them that look like varicose veins or like they have bruises on them or have been used before. You want to try to use the straightest vein possible. You also want to choose the catheter size that will not occlude that vein. When you evaluate the veins of the arm, again, you want to use straight veins, none that go crosswise or all curlicued. These are more apt to hold an IV catheter for an extended length of time. This is a diagram of an IV catheter that is placed in a hand. You'll notice there is an extension set attached to the IV catheter. This would be a wise choice so that way you don't manipulate the catheter or accidentally pull it out when you're trying to add IV therapies or medications or an extension set to it. You'll notice that blue cap. That blue cap is indicative of it is a needleless system, which is ideal. So that way the healthcare provider is not using a needle to access the system. This diagram here shows you the many different layers of the skin that you have to traverse to enter into the vein. You have the outer layer, you have the fat tissue, which is called the subcutaneous tissue. You may cross through some oil glands, cross through some hair follicles, whatever it may be, just to get down to the vein. When selecting a vein, you want to make sure you use a vein that is readily palpable. You want to be able to feel it. And visual, if at all possible. This promotes easy insertion and comfort. A palpable vein is more reliable than relying on sight alone. Do not palpate with the thumbs. Use the first two fingers of your dominant hand. Do not palpate after the site has been cleaned or it will have just been contaminated. Use straight, unused veins. Avoid any hardened veins or sclerosed veins or tender veins. Don't use any thrombosed or bruised veins or any cord-like sclerosed veins because they're prone to roll. They also have decreased flexibility and feel rubbery and cord-like. With IV therapy, you also want to consider the duration. How long are we going to leave this IV in? The site. Does the site permit freedom of movement for the patient? Do not immobilize the joints. Large veins in the antecubital fossa are good for drawing blood and for rapid infusion of a single dose of medication. So at the bend of the elbow, you want to try not to use that if at all possible. If the client will be needing IV therapy for extended period of time, choose a site that will support the IV therapy for at least 72 hours so that it can be changed out. Again, start at the best and the most distal vein of the hand and work your way up the arm. Some more considerations are the usual order of preference when putting in an IV is the hand, the lower arm, the upper arm, the bend of the elbow or the antecubital fossa, and then you'll need a provider's order to use the foot and the ankle. The veins of choice are the ulnar vein, the radial, the forearm, or the metacarpal veins. Start in the non-dominant hand so that the client can participate in their activities of daily living and feed themselves. Try to avoid using veins at any flexion points or at the elbow unless a stabilizing device is used. Veins of the lower extremity should be avoided if at all possible. Palpate the veins to determine the condition of the blood vessel and to differentiate a vein from an artery. Remember, the artery pulsates, you'll feel a pulse. Use the same fingers to palpate all the time to build up sensitivity in your gloves. You also need to consider the condition of the client. Will the client be using crutches or walkers? If so, they'll need their IV cannula started above the wrist in order for them to be mobile. If the client has a condition that has poor vascular circulation, such as maybe they had a mastectomy on that side or they had a stroke or an amputation, the affected side must be avoided. You also need to avoid extremities with impaired mobility. For example, let's say they have a broken arm or a fractured collarbone and they're in a sling. You want to try to avoid those. You want to avoid fistulas or grafts or any kind of dialysis shunts. Those should not be used for IV therapy. One should also consider the solutions to be infused. A hypertonic solution, or solutions containing irritating drugs or chemicals, will require a larger vein in relation to catheter size. It will be less likely that irritation will occur because rapid dilution may be possible. To dilate the vein, you should lower the arm below the level of the heart. You can have the client close their fist. They don't need to pump it. Sometimes this opening closing gives the patient something to do, especially if they're nervous or anxious. But simple fist clenching will do the job. You just want to tap the vein lightly. Don't smack it hard, no more than 3 or 4 times, or you can actually cause a vasospasm, where you'll see the vein jump up and look like it's really big, but when you go to stick it, it's going to be very difficult. Sometimes a warm compress, a warm washcloth, you just warm it up, put that on there for 10 or 15 minutes. It'll make it nice and easy to dilate the vein. You also use a tourniquet. Its only job is to descend the vein. And once that's been done and the vein has been accessed, you need to remove the tourniquet, because a tourniquet left on for 2 minutes or longer can cause tissue damage. When using the tourniquet, you want to apply it 4 to 6 inches above the site. In hypertensive patients or patients with high blood pressure, You may require the tourniquet to be placed even higher. In hypotensive patients or patients with low blood pressure, you may have to apply the tourniquet closer to the site. If the client has fragile skin, please take a washcloth and cover the tourniquet prior to using it in both children and elderly. This prevents pinching and tearing of the skin. Do not leave the tourniquet in place longer than 2 minutes, or you can cause nerve and tissue damage.